you today?
I'm good.
Great. My name is Monica. I'm a student nurse with Harper College, and I'm here to perform a head-to-toe assessment. Is that okay?
Sure.
Excellent. Can you tell me your full name and date of birth?
Artemio Gomez, October 28, 1982.
Excellent. And I'm going to ask you a couple of questions. Can you tell me where you are right now?
I'm at home right now.
Okay. Can you tell me what season we are?
Spring?
Can you tell me who the president is?
Donald Trump.
Excellent. Then can you tell me what year we are in?
2019.
Excellent. So he was able to answer my questions logically. His speech is clear. He looks well groomed and dressed appropriately. He's also able to communicate, and he's alert and oriented ×4. I'm going to start with my head-to-toe assessment. So first, we are going to assess. We assess the Snellen chart, which is vision acuity, and it's cranial nerve number 2. I also assessed his height and weight, and the height was 5 feet 8 inches, and the weight was 180 pounds, so that brings him to a BMI of 27. I also assessed the the vital signs. So we assessed his temperature, heart rate, respiratory rate, and blood pressure. And now I'm going to assess his head and face. So I'm going to touch your head. Is that okay with you?
Sure.
Okay, so I can see that the head is well proportioned to the body size, so we call that normocephalic. It is round. I'm going to palpate the scalp for any masses or lumps. I'm not feeling anything. I'm also going to look at the hair for any infestations, and I'm not seeing anything. The hair is straight and dark. I'm going to also assess the facial nerve number 7, cranial nerve number 7, which is the facial nerve. So I can see that the eyebrows are symmetric, the eyes are symmetric, the nasal labial folds, and the corners of the mouth. Can you raise your eyebrows for me? And can you close your eyes tightly? Can you smile and show me your teeth? And can you puff your cheeks? Like that? Okay, excellent. Next, we are going to assess the temporomandibular joint. Can you open the mouth for me? I'm checking for any crepitus or clicking. I'm going to assess the maxillary, I'm going to touch your face again, is that okay? Okay, so I'm going to assess the maxillary sinuses and the frontal sinuses. Did you feel any pain?
No.
Okay. So next I'm going to assess the eyes, and I can see that the eyes are symmetric. I'm going to assess the size of the pupil, and it's going to be a 5. And now we are going to assess cranial nerves 2, 4, and 6, which include the 6 cardinal positions of gaze, the accommodation test, and the pupil light reflex. So I'm going to ask you to follow this pen without moving your head, okay? Can you do that for me?
Sure.
Okay. So I'm going to make sure I always come back to the center, and I don't make rapid movements. And keep following my pen. Okay, the eyes converged, and now I'm going to shine my light into your eyes. Look at my face. Okay. The pupil is constricted, so I can document that the pupils are parallel, which means pupils are equal, round, and reactive to light and accommodation. Next, we are going to assess the conjunctiva and sclera, and I can see that the conjunctiva is pink and shiny, and the sclera is white. Next, I'm going to assess the nose. The nose is placed midline. The septum is also midline. The nasal flares are symmetrical, and I'm going to palpate your nose to check for any masses and lumps. I'm not feeling anything. And now we are going to assess the nose patency. Can you plug one NAR and then try to bring to the other side? Okay. And can you do the same with the other side? Excellent. So the nose is patent. Next, I'm going to assess the mouth. I can see that the lips are pink and shiny. And can you stick out your tongue? Okay, I'm checking the dorsal surface of the tongue. And I'm also going to assess, can you put your tongue up like that? Okay. I'm going to look at the teeth. I'm looking at the buccal mucosa. The gums around the teeth are tight. You can put down your tongue. And then can you say ah for me?
Ah.
Okay, so I was able to see the soft palate rise and the uvula, which is placed midline, and that's the gag reflex, which is testing for cranial nerves 9 and 10. I looked at the tonsils and also the roof of the mouth, And I also assessed the floor of the mouth, which is where all the cancers in the mouth can start. Next, I'm going to assess for cranial nerve number 12. Can you stick out your tongue as far as you can? Okay, so the tongue is placed midline. Next, I'm going to assess your ears. I can see that your ears are symmetrical and placed appropriately on your head. I can check for any lesions or masses. I don't see any discharge or any cerumen. I'm assessing the meatus. I'm also going to palpate the pinna, and I'm going to put pressure on the tragus. Did you feel any pain?
No.
And now we are going to assess the cranial nerve 8 through the whispering test. So I'm going to whisper something to you, and just tell me what you can hear, okay?
Dark hair. Dark eyes.
Excellent. Now we are going to assess the neck, and I'm looking at the neck line. I don't see any enlargement of the thyroid, the parotid, or the salivary glands. I'm going to assess the carotid and the pulse, one side at a time, with the pens of my finger, and the pulse feels strong and regular. And now I'm going to listen to the carotid with the bell of my stethoscope. So can you please take a deep breath and then hold it for me? Okay, you can let it go. And I'm going to do it again to listen on the other side. Okay, excellent. Now we're going to do some range of motion exercises and check the strength of the neck. Can you please look up for me and down, and then to the right and left? And can you put your ear to the shoulder? Okay, and then can you move your head against my palm, and then move it this side? Okay, and then can you shrug your shoulders? Okay, and that's cranial nerve number 11, the accessory. Next, I'm going to assess the lymphatic nodes. So I'm going to start with the preocular, postocular, occipital, mental, submandibular, jugular-digastric, superficial cervical, deep cervical chain, posterior cervical, and can you shrug your shoulders again? And supraclavicular. And I'm not feeling anything, which is normal. Next, we are going to assess the upper extremities, and I'm also going to look at the overlook skin color. I'm going to check for the temperature. I'm going to assess the nail bed and the capillary refill, and I'm going to assess the profile sign, which is 160 degrees, and I'm going to do the same with the other hand. I'm also going to assess the bilateral radial pulse, and now we are going to do some range of motion exercises and assess for strength. Can you please put your hands up and then behind your neck, and then can you go like this and like this, and then can you flex your elbow, go like that, and then can you go like this, and then open your fingers, bring them back, flex your wrist, bring it back, flex your fingers and bring it back. Okay, and now can you squeeze my fingers really hard as you can? Okay, can you pull my hands? Can you push my hands? Okay, and then here, can you bend like this? Okay, can you pull me? Okay, can you push me? Okay, and he's very strong. Okay, next we are going to assess the chest. So I'm going to ask you to take off your shirt, if that's okay. Okay, and I'm going to assess for the respiratory rate and effort, any use of the accessory muscles or bulging of the intercostal spaces. We are going to listen to the lungs, and we have 5 positions on the anterior chest and 9 on the posterior chest. And we are also going to assess the lateral side. I'm going to be listening for the bronchial sounds, bronchiovesicular. Bronchial sounds are over the neck, bronchiovesicular and vesicular. And on the posterior, it's going to be bronchiovesicular and vesicular. So I'm going to ask you to take a deep breath, and I'm going to listen to your lungs with my diaphragm. 1, 2, 2, 3, 3, 4, 5, 5. Okay. Can you please get up so that I can show them on the posterior side. You can take deep breaths for me. So we have one. I'm going to follow the scapula. 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Okay, and then you can turn this way. So this is our right side. So we have 3 lobes on the right side. We're going to listen to 3 sides. 1, 2, and 3. And then on the left side we have 2 lobes. So we are going to listen to 1 and 2 lobes. I'm also going to inspect the chest expansion. So if you can please turn. And I'm going to put my hands underneath the thoracic cage. And can you please take a deep breath for me? Okay, and I can see the chest expanding symmetrically. I can also see that the anterior posterior to transverse ratio is 2 to 1. Okay, you can have a seat. And now we are going to assess the heart. You can have a seat, please. You can lay down, I'm sorry. And can you please take a look to the right? Okay, so I'm going to assess the jugular vein for any distension, and I'm not seeing any. Okay, you can look. I'm going to listen to your heart for a full minute. And what I'm looking for is for S1, S2, or any extra sounds. And that's going to be in the mid-clavicular line between 4 and 5th intercostals. And I listen for a full minute. And then next we are going to listen to the valves of the heart, which are going to be, actually, can you please stand up? I'm so sorry. So that they can see where I'm listening. We're going to assess the valves of the heart with the diaphragm and the bell, and we are going to assess for any murmurs or brewing. So we're going to assess the aortic, pulmonic, tricuspid, and mitral. And then with the bell, same thing. We're going to assess the aortic, pulmonic, tricuspid, and mitral. Okay. You can lay down now. We are going to assess the abdomen, and what I'm going to look at is the contour and the shape, also the symmetry from the lateral side, and also from the from the foot of the bed. And I'm going to notice for any masses or lumps. I'm also going to assess the umbilicus. I can see it's placed midline and it is inverted. And then next I'm going to assess the aortic pulsations in the epigastric area. And I'm going to listen for the aorta, the vascular sounds of the aorta and the renal arteries, and also the bowel sounds. And I'm going to listen to the vascular sounds with the bell of my stethoscope. So I'm going to listen to the aorta in the epigastric area, and then the renal arteries, which are an inch from the umbilicus, above the umbilicus to the right and left. And then I'm going to assess the bowel sounds with the diaphragm of my stethoscope, and I'm going to start with the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Next I'm going to palpate the abdomen, and we're going to do a light palpation and a deep palpation. So I'm going to have to touch the abdomen, is that okay? I'm going to depress the skin about 1 centimeter, and that's going to be the light palpation. And I'm doing this with the pads of my fingers in all areas of the abdomen. And then I'm going to do a deep palpation to check for any organ enlargement, and that's about 5 to 8 centimeters. Okay, excellent. Now we are going to assess the lower extremities, and I'm going to look at the skin color. I'm going to assess for the temperature. I'm also going to assess the pedal pulse. I'm going to assess for the pretibial edema. I'm also going to look for any venous pattern or the hair distribution. I'm going to assess the toes and do assess the capillary refill for the toes, the shape, and the color. And while I'm here, I want to test the Babinski reflex, just because I don't want my patient to keep getting up and down. So I'm going to run this through your heel and across. Cross all the way to the sole of the foot and across, okay? Next we're going to do some range of motion exercises. Can you please pull my hands and then push like you push the gas, okay? Can you bring your feet together and apart? Can you try to bring your sole of the feet together? Okay, nice. And then can you lift this leg and hold it for 5 seconds? 1, 2, 3, 4, 5. And then can you move it out and inside? And then can you move it against my arm and against my other arm? Okay. And then can you do the same? Can you hold it for 5 seconds? 1, 2, 3, 4, 5. Okay. And then move it out and in. And then move it against my hand. And then move it against my other hand. Okay. Can you flex your knee and bring your knee inside and outside? And then can you do the same with the other leg? And this is assessing for the hip strength. Excellent. Now can you please sit down so I can inspect the strength of the knees? Can you push my arms and can you pull? Excellent. Now can you please stand up? And we're going to do this and then flex and then this and then flex. Excellent. Now we are going to perform the neurologic assessment. Can you please have a seat again? Sorry. So when you feel this on your skin, just say no. Can you close your eyes?
No. 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 No.
Okay, excellent. We are going to assess for sharp and dull. So I'm going to show you what sharp is and what dull is. Okay, so you just let me know. Close your eyes.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, excellent. And now can you please stand up and then run your heel to your shin, heel to the shin. Okay, can you touch your fingers with your thumb to every finger really fast? Okay. Can you close your eyes and stay like that for 20 seconds? 1, 2, 3, 5, 10, 20. Excellent. And then can you walk normally that way? And when you come back, can you walk heel to toe? Heel to toe. Okay, excellent. And now we are going to assess the reflexes. You can have a seat again. And I'm going to assess the biceps reflex. So you can flex and relax. I'm going to find the tendon. Okay. Okay. And then flex and relax. I'm going to find the tendon. Okay. Excellent. And we are going to assess the quadricep reflex. Okay. You can relax your legs. Okay. Excellent. And then you can get up, please. And we are going to assess the spine. So if you can please turn around, and I can see the spine is symmetric. I'm going to look at the shape of the shoulders, the scapula, and the gluteal folds. And then I can see that the thoracic side of the spine is convex and the lumbar is concave. Can you please touch your toes? And I can see that the spine curves like a C, which is normal. And then we're going to assess the strength of the spine. Can you go like this? Okay, and then I'm going to hold your hips. Can you try to turn to the right and your left? Excellent. And this concludes our head to toe assessment. Thank you.